Welcome to the Living Life Well show, the intersection of God's Word, today's science, and healthy living with common sense application, all based on the truth of the Word of God. I'm your host, Dr. Jon Skelton. Now let's get straight to the truth. All right, welcome back to the Living Life Well show. Today, I'm excited to talk to you about the recent ban the FDA has placed on Armour Thyroid, NP-Thyroid, Nature-Throid, and as they refer to it, animal-derived therapies. And so let's just jump right in. So Armour Thyroid, NP-Thyroid, Nature-Throid, the FDA refers to these as biologics. What they are saying is that they have not gone through the proper certification to be in a prescribed format because they have not received the biologic certification that became necessary in 2009-2010 kind of time frame. Well, there obviously is a reason for that. It's very expensive. It's very cumbersome. It's a long process to get that certification. And so for the last now 16 plus years, apparently hasn't been an issue. But recently, what the FDA is citing is that they're citing quality control issues dating back to 2019 and 2020. They're saying that their inspectors went there, inspected, and they were being reported as adverse events, meaning that patients were having adverse outcomes. Well, what were the primary adverse outcomes? Either under treatment or over treatment, because as they report, you are getting a biologic substance and then using that to treat humans. As you can imagine, a biologic substance can have varying levels of hormone associated with it. So let's get right in. So what is a biologic substance in this instance? In this instance, it is primarily essentially porcine or pig thyroid gland. The thyroid gland is ground and then it is dosed in something called grains typically. And that is how we determine the dose when we are prescribing one of these combination biologic substances. Well, why even prescribe this in the first place? Well, the reason is because for really decades, back into the 1950s, when we treated thyroid, we treated with one form of thyroid hormone, the active form of thyroid hormone, T3, or otherwise known as liothyronine, which is the manufactured or synthetic form of thyroid hormone. In your body converts T4 to T3. Well, back in the early 2000s, levothyroxine, or T4, was then produced synthetically and has been mass marketed and produced throughout the U.S. to the tune of some 20 plus million people being on T4 therapy. Well, many people are having to escalate the dose on the T4 therapy, plus they're also being placed on a synthetic, a laboratory-derived substance. Many people don't like that. Many people don't respond to it well. Historically, thyroid hormone in the past was known to be different in brand name versus generic. We see that less and less nowadays, but it would be that you would switch somebody from the brand name to the generic, and it would require an increasing dose to meet that same level of treatment, that same level of result and increased energy, daily functions for every area of your body, your metabolic rate, all those things that we use a thyroid hormone for. So in 2002, T4 really hit the market and became the big thing that everybody prescribed and is still the most widely prescribed form of thyroid hormone today, being just T4. Well, now you have these biologics being Armour Thyroid, Nature-Throid, Nature-Throid and NP thyroid that really have been around in some form since about the same time as liothyronine, the T3, if not even before that, actually, because we were using it a long time before that and had been using it successfully. But what the issue is that between the late 1960s, yes, that's how far back this goes, to these early 2020s now, there have been, quote, 500 adverse events. That is a span of roughly 5 decades, 50 plus years, 500 adverse events. Those adverse events may have been underdosing or overdosing based on the thyroid concentration in the animal that it was derived from and then packaged and prepared for human consumption. That is the vast majority of these. The other adverse events are reported viral transmission through this, as well as reported process and elemental related impurities, meaning it wasn't able to be purified to the standard that they've set that they believe that it should be. And while I believe all those to be true, really when you look at the potential for underdosing or overdosing with thyroid hormone, it very well could be to the fact that there is a little bit of nuance when you are taking a thyroid from an animal and then using it to then treat a human issue. And so there can be issue with that. However, I will also tell you there's an issue when you use synthetic T4 or synthetic T3 as well. It is very easy to underdose or overdose. It depends upon how the patient takes it, depends upon many other processes that are going on in their body. And so the same thing with underdosing or overdosing can occur with regular synthetic hormone that is prescribed by your doctor as well. Now, their specific report is that you can't rely on the concentration that is coming from the animal for accurate treatment for the problem. And I would agree with that, but again, I say that potential to undertreat or overtreat could have been as simple as the patient not taking it as accurately as they should. Changes in the way or what they're taking it with will affect that level that gets absorbed into your body as well. So those are the objections from the FDA to the manufacturer, AbbVie, for Armour specifically. Well, who is this really affecting? Well, it's affecting a little over 1 million people. About 1.5 million people are estimated to be on these medications. So not a small amount. I will tell you in clinical practice, I use these most commonly because what I see is an inability to convert T4 to T3 accurately in patients with thyroid disease, in patients with Hashimoto's thyroiditis or autoimmune thyroiditis, patients that have reactivated mono that are affecting the thyroid, or patients with other issues, maybe sleep apnea and other comorbidities that are contributing to thyroid disease. So when we look at treating the thyroid, many practitioners just focus on the TSH and the T4 and they stop right there. And so they look at these things and they say, okay, well, that's good. Some practitioners will go a little bit further and look at T3. Those are going to be most of the practitioners that will then start prescribing one of these biologics because they realize that T3 is the active form. It is what is really affecting your energy, your mood, your bowel habits, your skin, your hair, all your metabolic rate, your physiologic components. It's the T3 that is the most active in all of these areas. Well, so now we have one medication on the market called Cytomel, or liothyronine is the generic name, which refers to T3, and it is good. It will help treat your thyroid. However, again, as I've said, usually it's a dual deficiency, a deficiency in T4 and T3. There is not, to my knowledge, a currently available combined product outside of going to a compounding pharmacy to make this product. The issue with this ban that is occurring, again, 12 months from now, so for the people that are on Armour or NP Thyroid or Nature-Throid, don't just get totally excited yet. This doesn't mean that we aren't going to get a resolution between now and then. Hopefully that will occur. Hopefully you can reach out to the FDA and specifically to Secretary Kennedy, asking him to, give us a little bit more time on this ban, explain this a little bit more thoroughly, look into it more in depth. Because considering that, we have so many millions of people on thyroid hormone throughout the country, in addition, and in my estimation, of that 22 million that's on the synthetics, many of them are being undertreated in one of the categories, either T4 or T3, and thus may be overtreated in one of the categories of T4, most likely because they are trying to raise the T4 level such an amount so that the T3 levels are higher, because they're not addressing the underlying inability of that particular patient to convert T4 to T3. They're not looking at their iodine consumption. They're not looking at their selenium. They're not looking at the zinc that they are taking in. And so they are over treating on the T4 side to get the T3 level up enough so that the patient doesn't suffer these consequences of hypothyroidism chronically. So for those of us that prescribe Armour, that prescribe NP, that prescribe Nature-Throid, what that means is a couple things. If this ban ultimately does go through, and there is a year for these companies to start meeting the FDA's demands and go through this certification process to get that done, what I anticipate will happen is that AbbVie will ultimately acquiesce and go through this certification process. That most likely what will happen is that the FDA will extend time in good faith that AbbVie is attempting to go through this certification process to get certified as a biologic. Now, once they do that, what I think is going to happen is the price of Armour and NP and or Nature-Throid, whoever does go through this process, is going to increase dramatically, because it is an expensive process to get certified as a biologic. Now, hopefully that won't be the case. Hopefully cooler heads will prevail and there will be a streamlined process that they can do this over a longer period of time without as much need for these rigorous studies for a medication that's been used for decades now with very, very minimal adverse events when you consider how long it's been in use and the amount of people that have been using it. But time will tell. So what does that mean for us prescribing and us taking these substances? Well, assuming that the ban goes through, what that means is that for those of us that have a T3 need, you will have to be supplemented with liothyronine, the synthetic form of thyroid hormone. Again, it's been around since the 50s, again, considered to be very, very safe. But again, it's a synthetic. It's not a natural occurring product. It was made in a laboratory. Same thing with the levothyroxine, made in a laboratory. All of the patients that are on Armour or NP or Thyroid, they need not only T4, but they also need T3, because they don't generally have enough T4 and they aren't converting the T4 well to T3. And so both levels need to be supported. Well, what that means is currently in the current system, that means that you have to be on 2 medications, or you have to get your medication compounded. Well, insurance companies don't like paying for two medications, and insurance companies sure don't like paying for compounding. So what that typically means for the patient and the physician, it means that you end up having to fight for the dose that your patient actually needs to get coverage for both the T4 and T3, because now you're treating with two different medications. That's two different prescription copays. That's two different pills that you're taking each and every day. And so, from a patient standpoint, that's just not great, right? From an insurance company standpoint, that's not so great either, right? You're paying for two things. So what they will do is they will tend to err on the side of paying for one but not paying for the other. The other thing that we see is needing to be on both and wanting to have it in one pill. And that absolutely can happen. And it typically is going to happen through a compounded pharmacy. Now, my understanding of how you get an insurance company to cover that is you have to have it required that you need a dose that isn't currently manufactured and made to be able to treat your thyroid. So, for example, if it comes through that you need 30 micrograms of levothyroxine and you need 8 micrograms of T3, that would be a dose that isn't readily available in manufactured form. And so you could get that compounded through a compounding pharmacy and your insurance benefits would apply. However, generally speaking, when you're talking about anything compounded, including the Armour biologics and Nature-Throid, MP Thyroid, usually the copay with those are higher. Usually the insurance company is going to put more patient responsibility towards the cost for the drug. And that is no different with these compounded medications. It's the same thing that we're seeing currently with these GLP-1s. With this compounding ban, they alleviated that ban for these GLP-1 medications in all dose forms when the manufacturer could not keep up with the demand. Now that manufacturer is keeping up with the demand, the compounding pharmacies can still make these substances. However, they have to make them in doses that are different and aren't commercially available. So that is most likely the route that this is going to go. You're either going to get on two medications with some hassle from insurance companies. And many of you that have been on Armour, MP Thyroid, or Nature-Throid may have already had these hassles occur when you were initially being prescribed the medication. However, I think it's going to be a bit more of a headache, unfortunately, as we go through. So, that being said, I think now is the time to not get excited about this, to not start stockpiling your meds or ask for extra medication to be considered, but to really have a conversation with your physician about, hey, how can I best help my body convert T4 to T3 so that I can support myself as I go through to maybe even, reduce your dose of Armour, NP, or Nature-Throid. How can I take it more effectively so that it gets absorbed more easily and is used more readily? And then really looking at those things that support that conversion, the iodine, the selenium, those things are going to be important for anybody that has thyroid disease, regardless of whether it's an autoimmune condition, whether it's just a T4 deficiency or a T3 deficiency. Keeping healthy levels of zinc and iodine and selenium, as well as even vitamin D, is going to be important, and vitamin A for that fact as well. So with that being said, I don't want this all to be doom and gloom. There is hope. There is, in my mind, a possibility that these medications, these vital medications, won't go away, that there will be some change or moratorium on this ban that will allow cooler heads to prevail and get this straightened out for all the people that really need this. So that's it for this episode. I do want to let you guys know, especially if you're in the Lubbock area, I have a course that I taught last spring that I'm teaching again at Trinity Church this fall starting September 3rd. It'll run for 9 weeks from 6:30 to 7:45 on Wednesday evenings there at Trinity Church. And if that is something that you would be interested in, we'll be discussing lots of things just like this. And then we'll really be getting into the truth of God's Word, maybe some what seems to be even hidden truth, if you will, about really being able to help ourselves in this modern society with what the Bible tells us is good and healing for our bodies, and what we can do even today from a dietary standpoint, from the way we approach life standpoint, to really confer true wellness, be it physical health, mental health, and of course spiritual health. And so we'll be touching on all those things. And really, I'm really excited about this because we have people reverse autoimmune disease in this last course. And so we've had amazing outcomes with weight loss, getting off of multiple prescription medications, all of these things just by going through this course. And this course is free, and so space will be limited. If you're interested, I'd recommend you look up Trinity Church here in Lubbock. We'll also have a link to it in the show notes here. If you would like to sign up for that class, we would love to have you. So thanks, and God bless. That's it for this episode of the Living Life Well show. If you like what you've heard and want to learn more, or want to know how to put this into practice for yourself, go to livelifewellclinic.com. Until next time, this is Dr. Jon Skelton saying go out and live the truth so you can live life well. The preceding is for entertainment and educational purposes only. It is not meant to be used to prevent, diagnose, treat, or cure any condition. The information contained in this show does not substitute the need for a qualified medical professional, nor is it meant to provide medical advice or services. If you feel information presented in this show may apply to you, we recommend you seek out the help of a qualified medical professional who can evaluate and treat your specific concerns.